Welcome to Reimagine Healthcare, the show where we take a hard look at the future of Canadian healthcare by featuring inspiring doctors and leaders who help shaping it. Today, I'm joined with Christopher Fisher from Ontario Partner in Health and Capital Digital. Hi, Chris. Very happy to have you here at our offices.
Thank you, Elias. I'm very happy to be here.
How about we start by you telling us who is Christopher Fisher and how did you get into the healthcare industry?
Well, I'll try to keep that story short. But who is Christopher Fisher? I have a company called Ontario Partners in Health, as well as another company called Capital Digital. I have been working in the primary care clinic management industry for the last 20 years. Mm-hmm. I think today is actually my 20th anniversary. Oh. And then prior to that, I was 9 years in the pharmaceutical industry. So I'm somebody who really focuses on how can I bring concrete, practical solutions to the industry. I've always considered myself to be a nuts and bolts person, not a high-level policy thinker. So today's discussion is going to be very focused on concrete things that we work with at the clinic manager level.
Awesome. And when did you found Ontario Partner in Health? How it started, and why did you do this organization? Why you started this organization, if you don't mind?
Yeah, so that's a good story. Ontario Partners in Health actually has a precursor company, which was the University of Ottawa Health Services. And the University of Ottawa Health Services was founded in 1989 by Dr. Don Kilby. Mm-hmm. Essentially at that time, universities, so the University of Ottawa, they were outsourcing a lot of the departments and services that they used to offer, and they were required to offer under legislation to students. And so Dr. Kilby, who at that time was one of the physicians, the current director retired. They offered him the directorship, but he suggested that they come to an arrangement that would outsource it. Because one of the challenges with a campus health center is recruiting and retaining physicians because often it's a very limited scope of practice, right? Students, young, healthy individuals. And he wanted to be able to offer a whole scope of family practice to physicians that would come and work there. And so he founded University of Ottawa Health Services and ran it and grew it for many years. He recruited me in 2006 to come from the pharmaceutical industry, where I was working in Montreal, to move to Ottawa and to take over as Director of Operations, to really take it to the next level. There were a number of programs that were introduced by the province of Ontario that he wanted to take advantage of, but as a full-time physician, he didn't have the capacity to take on that administrative work, and so that's why I was recruited. Yeah.
I'm curious to know, you graduated in political science. What was the trigger to get into the healthcare industry?
That's a good question. I would say that there was no straight line between my studies and where I've ended up. It's a series of opportunities and coincidences. I always say that, I always laugh a little when I say that I have a bachelor's in political science because it's purely irrelevant to everything I've done in my life since. When I graduated in the early 90s, early to mid 90s. And for those of you that are, around my age, you'll remember that was a pretty deep recession. There was a lot of unemployment, particularly at the level of government. And so an opportunity to work in the foreign service, I thought I was going to, travel the world and work in embassies and that kind of thing. Those opportunities just didn't exist. The federal government was not hiring, hadn't been hiring for years. And so I needed to pay for my student debt, so I got a job and I was working for Kraft Foods. And I found that I really enjoyed sales. I really enjoyed, administering a territory and working with clients. And I did well there. I moved up several levels, and then I was noticed by people in the pharmaceutical industry. And so I was recruited from the food industry into the pharmaceutical industry. With the proviso that I knew nothing about science and I knew nothing about health. And I warned them that I was not going to be particularly useful in terms of health and science background. They said they wanted somebody with more of a sense of sales and customer service to work with their people and their physicians, and so that's why I was recruited.
Awesome. Yeah. Well, congratulations on your 20th anniversary in this industry.
Thank you.
And if you had to make your journey all over again, what tips would you give to your younger self?
Oh my God. I don't think I've hit that point yet where I'm looking back and reflecting and coming up with all of the learnings that I should have acquired over my lifetime. So I don't know if I have a lot of tips. I think one of the things that has made my career path as interesting as it's been is I've always been very open-minded. I've always been very interested in what else is going on, what else is out there, what are people doing. And so I never saw, even though I just talked about how I saw limits for myself going from the food industry to the health industry. In general, I didn't see a lot of limits. I felt like I could learn things, I could figure things out if I attached myself to the right people and I made the right, the right connections with folks who knew better that I could learn from, then I could do well. And so I think I would just reinforce that with myself, and even be more open and bolder and more willing to take risks and chances into new areas, and not be complacent.
So I hear open-mindedness, being bold. I associate this a lot with courage. Any other core values that makes Christopher Fisher what Chris is today?
I think I would say that, and I don't know if most people would consider it a core value, but I'm very much a solutions-focused person. So I'm always looking for the solution. And this goes back to my early days, in the sales industry, where I always, put myself in the shoes of the customer. And I felt like it was my job to figure out the problem, figure out a solution, and bring it to them. I was a sales representative, but I often felt like I represented my customer with my company. And my job was to find solutions for them. And so I've always brought that with me. So maybe the value is a customer service value. But it really has always been about focusing on the solution and not getting caught up in the process.
Awesome.
But really saying, like, how do we get to where we want to get to? And not worry about the politics and all of the barriers that can come up, and just find ways to get over them.
Can I call it customer obsession?
Sure. You're going to find, it sounds funny to say this, but you're going to find I tend to downplay and be a little humble. I shy away from making big pronouncements like that seems big to me, like obsessed with the customer. I envision an incredibly high level of excellence that comes with that. And I don't feel I'm there yet. I feel we're always striving to that. So continuous improvement is maybe more the value that I would ascribe there. But to me, it's about the people, and let's solve problems. Where can we be useful? Where can we be effective? How can we make things better? That's always been my approach.
So I want to double click on the problem that the clinics are living every day, and want to zoom in on clinic management itself, because this is where the real pressure of healthcare is. If we put patient care on the side, what does operating a clinic really is about?
Everything. I think the thing that people underestimate or maybe don't realize is that it's a business. It's a complex organization with a lot of moving parts. And so when you're a clinic manager, you are literally doing everything. And you're usually doing all the same things that a large organization has to do. And I'm talking in the primary care context. You're doing everything that people in a large organization like a hospital or any kind of company have to do in terms of the functions, but with far less resources, both in terms of people, but also in terms of financial. So it is HR, it is facilities, it is technology, it is finance and billing, it is strategy, it is compliance, it is governance, it is all of those things. And that falls largely on the clinic manager, who is usually not trained and not, hasn't come up through that, has had to acquire all those things whilst keeping the doors open, dealing with patient complaints, dealing with onboarding staff physicians. I mean, I could go on and on and on.
Awesome.
It is really everything.
And how do you define a high-performing clinic? What would be the metric that you monitor and, in your opinion, defines clinic success?
That's a really, it sounds like a simple question, but it's kind of a complicated question, because I think it depends on your perspectives and what your main priorities are. So because we're in the healthcare, we're in the business of taking care of people, quality metrics should be important. and they are important. As a family health team, so we've managed family health teams for 20 years, almost 20 years. And we have a whole series of quality metrics that relate to patient care that we need to be performing against. And that's all very important. At the same time, you want to look at performance metrics that are more along the lines of output, or more along the lines of resource utilization, or more along the lines of financial return. And generally speaking, that last one, financial return, is the last one that gets looked at. I think most clinics don't have necessarily a really good handle on their finances. They produce a balance sheet, they produce an income statement, but sort of where's the money going? What are the levers you can pull to improve those things is sometimes a bit of a mystery, because there is so much going on. There are so many things that are not quantified as accurately or as well as you'd like. Systems don't necessarily exist to account for these things in ways that you would like, or the cost of those systems is too prohibitive given the revenue constraints. But you also have to remember that most clinics are owned by physicians, and so physicians are in a unique place. They may have a manager, but they don't necessarily treat the clinic as a business, because they are the source of revenue. 95% of the revenue or more comes from the physician's activity and the billings that are paid directly to the physician or to the physician group. And so most physicians look at clinic operations from the perspective of expense.
Yeah.
Right?
Fully agree.
So they are focused on expenses, because every expense most physicians will view as money coming directly from their pocket, because it's literally as a percentage of their individual revenue. And so it makes it difficult to take a more business approach and to take a more investment approach on the financial side and on the operational side when physicians are focused on the expense side. And it's very understandable that they are. It's really the way the system is set up. And really, their biggest priority is patient care. Yeah. Not the finances. So you can't ask them to devote hours and hours and hours to analyzing the business, right? Yeah. So,
but this is something that surprised me, coming from a business where, like, the one of the most interesting advice I got when I founded Med for a couple of years in building the company, and the first 4 years were really tough on us, and it was hard to survive as a company to do it. And one of my mentors told me the best gift you can give to your customer is to stay alive, to be there for them, not to belly up and go bankrupt. So being profitable helps you deliver better service, better product to your customers, and this profitability, this financial viability is very important for a business.
Yeah.
And when I meet clinics and clinic owners, I always feel that this is not top of mind, and I wonder why. I feel like if there is more profitability inside the clinic, a lot of things can be improved. Like investment in technology, investment in more staff, investment in patient experience. Yeah. So, in your opinion, is it a bad thing or a good thing to seek profitability as a clinic? And second, how you put guardrails in order not to let the profitability compromise the quality of care or the patient outcome?
Yeah. So I firmly believe that profitability is good, and that profitability can be an important tool in improving the patient experience, right? I absolutely believe that. I think it's important. So I'll give you an example. Physicians chronically underbill. So there's money that the government has allocated to certain services and acts, and all they have to do is put the right codes and send them in, right? And follow up when they get rejected or when there's an error. And it's very tedious. It's very tedious, and it's complicated. And I got to say, the provincial agencies don't make it easy. Yeah. But that's money that's rightfully earned by the physician and should be claimed. Estimates are somewhere along the lines of 20% underbilling.
Yeah. Can you give me a couple of examples on that?
Oh, all kinds. So usually underbilling is related to the fact that the physician is in a busy clinic day, and they're focused on the patient and the issues that they're dealing with the patient. And they're not looking through the lens of, oh, they just said that, or I just did this, that equals this billing code I can use. With some exceptions. There are some physicians that are extraordinary at this, but they're rare. the focus is really about how can I help this patient today? What do I need to do today with this patient that's about their clinical care? And the billing always comes second. And I think a lot of times people default to a very restricted set of codes. They're not, they're not able to sort of organize their business in such a way to maximize their billing, meaning, address this little extra piece, ask them this extra question, take this extra 4 minutes that gets you over a time-based code limit and allows you to bill an additional unit, things like that, which honestly requires a lot of headspace that physicians aren't able to make available for those kinds of things because they're focused on the patient's needs.
Is there an opportunity that exists for clinic from uninsured services?
No, huge. So I was going to talk about that as well as another opportunity. So I talked about missed billing in terms of provincial payer. There is massive missed billing in terms of uninsured services. And that happens for a couple of reasons. One is many physicians are reticent to ask a patient to pay a bill for a service because we in Canada, I work in Ontario, and in Ontario, there isn't as much of a developed private system as there is in Quebec right now. It's coming slowly, but it's really reserved for executive medicine and a few other things. But for the most part, government pays for healthcare. Healthcare is free, is the notion that most patients have and many physicians have accepted. And so they're very reticent to have a conversation around money, particularly in the context of a clinical visit, right? They really feel that compromises the patient-physician relationship, and I understand that reticence. You don't work in medicine if you don't have a lot of empathy, so you don't want to ask people for money when they're vulnerable.
So the clinic that you're helping, how you approach this with the physician, how you bring the physician on board and have the right discussion and make sure that they get the rightful right to bill, whether insured or uninsured billing, and because this money is going to flow to the clinic and it's going to flow to better infrastructure, better everything. How you approach it with physician?
So we definitely talk about what the benefits of increasing the revenue are. And I think a lot of physicians that resonates with them because more and more they're seeing that expenses continue to go up, but their revenue is not keeping pace. And it's not keeping pace in terms of what's accorded to them under the scheduled benefits from the provincial payers, and it's not keeping pace in the other opportunities that they have for revenue as well. They're working more for more or less the same in terms of revenue.
Any workflow you implement to capture this revenue stream?
For uninsured services, absolutely. So uninsured services, the first hurdle is getting over the reticence to ask for money and to charge for things. I think what we try to do is find that balance between the desire on the part of the physician to not cause that friction unnecessarily to a patient, but still to recognize the value of what's been provided because it's a service. And so we try to take the conversation out of the hands of the physician and systematize the approach. So we want our front desk to broach the subject and do collections. We want to automate the billing process. We want to make sure that for the most part, the physician doesn't have to address the question. We don't ask physicians to collect, even though they would be far and away the most effective bill collectors. But again, that's leveraging that patient relationship, which is sacred. You don't want to start making that about money. So we try to put systems in place where we capture that billing in a way that does not involve the physician unduly, but is effective. It's a challenge. I'll be honest with you. It's a challenge.
And when you walk into a struggling clinic, what are the first 3 things that you would assess or analyze and you look for?
Yeah, the classic is workflows, right? Are there opportunities for efficiency? And generally there are. The next would be, so workflows is about how you organize the work, right? What the steps are, what the flow of the patient visit is, what the flow of all the different processes are. Are there unnecessary steps? Are there things that are being done in redundant fashion or in the wrong order, that kind of thing. So workflows is important. The next one would be, and it's related, is technology. What technology advancements can we bring into place that will definitely improve those workflows, make them perhaps more automatic, make them perhaps more efficient or more comprehensive or complete. So workflows, technology. And then the next thing I think is really looking at, how's the staff? because that's the biggest challenge. This is a people business. And, the patient experience is highly dependent upon all the people that they encounter within their relationship with the clinic. So the front desk people, the nurses, the administrative or billing staff afterwards, obviously the clinicians that they're working with. But all of it matters to the patient experience. And so how well resourced, how well trained, how well motivated are the staff and all of the people that are working within the clinic to deliver care, and what can we do to improve that?
Awesome. So let's talk about staff. Based on the government of Canada here, there is 84,000 workers as an clinic administrative positions, and there's more than 40,000 openings that are going to happen in the next decade.
Yeah.
Right? It's a scarce resource. It's people that juggle multiple type of tasks, so it requires it's not an entry job. It requires some skill set. I used to call them superhumans, and I didn't meet a clinic where they had all their positions filled.
Yeah.
So what are the strategies that you apply to find this type of talent, what you look into this type of talent, and how you retain this type of talent?
And retention is key. Retention is a big challenge right now. If I had the solutions, we'd be having conversations from somewhere very different right now. But definitely the challenges in human resources are having a major impact on the health industry overall. And I have to say that primary care probably, in the balance is suffering more because we're already resource limited. We're already resource constrained. And so we don't have the budgets. We have to generate our own budgets in order to pay our people. And as we've noted, expenses are going up and revenue is not keeping pace. So the strategies to me are around recruiting good people. So how do you do that? Are you able to have programs where you welcome students that are involved in the health industry? Maybe they are studying at university in health sciences and want to be nurses or doctors, or maybe they're doing a medical office administration at a college. Can you create those relationships with those schools in order to have those students in and have them get their feet wet and get a taste for what it's like to work in primary care in your clinic, and create that relationship early, and perhaps then when they graduate they stay on, and you've got someone that essentially you've already trained, right? It's an investment, and a lot of clinics will say, oh my God, they're more work than a person off the street. I get it. But I think that's an investment that you need to make. It should be one of the pillars of your strategy for recruitment. Otherwise, recruitment is tough. I would say you have to recruit not necessarily for a job description in terms of a set of prior experiences or skills that are directly relevant. We've often pulled people from any number of different industries. And what you're looking for are transferable skills. So you have to widen your vision as to who could be a good candidate. Now, obviously, I'm not talking about a nursing position, or I'm not talking about a clinical position where you have to have training and experience in order to do that job. But your administrative support roles, for example, some of my best finance and billing people have, I won't say political science degrees, but the equivalent. They have good reasoning skills, they're well organized, they have good communication skills, and those are transferable skills that they can then apply to those positions. So, I would say opening our horizons in that respect. And then the other thing is to really create an environment that's going to retain those people. And honestly, we all know, right, that salary, while it's a factor, is not the biggest factor for retention. And particularly the generation that's entering the workforce now, they're looking for meaning. They're looking for, how do I make a contribution? How do my efforts have an impact? How can I be recognized, be part of something bigger than myself? How can I be inspired, right? And so I think your culture is paramount for recruitment and retention. And culture is tough because you can proactively and mindfully, conscientiously create culture, or you can live with the culture that creates itself in the absence of your efforts. Every workplace has a culture. Yeah. Right? You're either.
I'm curious to know how you implement this culture, how you build this culture.
Yeah, it's tough. So I think having a clearly defined purpose, having a clearly defined focus as to what are we here to do and how do we do things, and I speak. There's of theoretical here. I'm always conscious of, who knows me and has worked with me and has seen, the struggles we've had in some of our clinics and is going to say, what's this guy talking about, right? But the reality is that it's still there. It's still there. We talk about a vision and a mission. Those that need to be more than just something that you throw up on a website and never think about again. That has to be something that's in your daily conversations. You have to support people. You have to give people opportunities. You have to let them make mistakes. We have a tendency in healthcare to try to over-script people, to over control, what they do and what they say. And that discourages people sort of stepping out and going above and beyond for the patient, right? And making decisions for themselves, right? And offering that level of customer service. So I think culture is key, and every organization is going to create its own culture, and it has to be from top to bottom. And the most important people in a medical clinic in terms of setting a tone for culture, you can imagine, is the family physicians. In a primary care clinic, it's the family physicians, and in any other clinic, it's the physicians. They set the tone. Everybody looks to them. And so, we're in a culture right now where physicians are burnt out, physicians are struggling, physicians are kind of narrowing their vision in many ways, just to hang in there, right? Just to deal with what they're dealing with, and everybody feels it.
And let's double click on that. I fully agree with you. And what do you think is a top contributor to this kind of burnout?
For physicians?
For physicians. Actually, last statistics I got a hold on a couple of weeks ago, 51% of physicians has a sign of burnout in Canada.
Yeah, I see it. I see it all the time.
Yeah. Like that's not a fun workplace to work.
So, everybody talks about the administrative burden. And I absolutely agree that the administrative burden is a major factor in physician burnout. Because just to talk about administrative burden, I think why is that an issue? It's not so much. Yes, workload is an issue, right? In terms of the hours spent dealing with the flow of information. EMRs like Mile or others are amazing for all of the comprehensive information that they bring to the care of a patient, right? They are just fantastic. The other side of that is that it's a lot of information coming at people day in, day out, never ends, and I think for a lot of physicians, part of the stress associated with that flow of information is the fear that somewhere in there is something that is critical to the health and welfare of a patient that they could miss. I think that keeps them up at night. I think juggling that constant flow of potentially, most of it is not, by the way, most of it is not critical in family medicine, but the fear that one thing that's there that they miss is everything, because it could have catastrophic consequences for a patient and for a physician in terms of their license and their confidence in practice, all of it, right? Their careers. Okay. So I think that is the thing that makes the administrative burden beyond just the work, the level of impact that it has in terms of burnout.
And I fully agree with you on that. Like, this is what we obsess on and Medfire is how we can minimize the context switching for physicians, how we can bring them solution in a more synthesized, easy way to grasp and help them work.
Yeah.
Lately, we saw a lot of AI scribe getting their way into the clinic.
Yeah.
Do you feel it's really contributing to reduce this cognitive load?
I think it definitely addresses an element of the cognitive load for those that have embarked with it. So if I look at the clinics that I work with, the level of uptake or adoption of AI Scribe is still pretty minimal. And it's like any technology. It's like any new thing. You will have your people that are at the forefront, your early adopters, who very quickly get involved with that new technology, and they start to reap the benefits rapidly. And I can't tell you the number of conversations I've had with physicians who are not using Scribe that literally sell to me the benefits of Scribe,
but they don't use it.
And so they sell to me the benefits because they're observing their colleagues who are using it. And they're actually noting that their colleague gets out earlier, doesn't seem as stressed, took on more patients, like all of the things, right, that they're not able to do. And they actually say it's because of the adoption of the AI Scribe. And then I say, well, when are you going to start using the scribe? Oh, I don't know. I don't have the time to learn it. Or anyway, there's all kinds of things that come up, right? And it's like
this is where my
human nature. It's crazy.
100%. Yeah. This is my salesman talking. Is that I think when they have it integrated into ZMR, and they don't have to choose choose a vendor and find a vendor, choose a vendor, sign up for a vendor. When they have it already there, waiting for them, without having two different windows to do, I think that's going to contribute a lot.
I think it'll help.
Yeah, and we see it because like we acquired Kerway a year ago from February 7th. We acquired Kerway, and we see the level of adoption in a clinic where the AI scribe is integrated, and we get the best adoption of the AI scribe is when it's fully integrated into the EMR.
Yeah.
And even with the integration we're talking is below 40%.
Yeah.
Like still around 30-something%, the level of adoption.
Yeah, I mean, but that is not unique to AI Scribe. You can take the example of EMRs. EMRs can do so much, but when you look at the level of exploitation of all of the potential benefits that an EMR can bring, just in terms of documentation, like most physicians are using it at a fairly basic level. Most clinicians are using it at a fairly basic level. They're not leveraging all that the EMRs of today or even yesterday could do, right? Yeah. And that's just human nature. I work in Outlook and Microsoft Office for a lot of what I do, and I guarantee you I'm using maybe 20% of what it can do. So I speak from a place of being one of the crowd that has not adopted these things to their full potential, and I get it. So I think it's step by step by step. You know?
Is technology adoption a key driver to optimize clinics and clinic profitability?
I think absolutely. However, it has to be the conscious, strategic adoption of technology, right? Lots of businesses and clinics and just human beings have adopted all kinds of technologies without a plan and without a strategy, and without making that investment into making a really judicious choice of technology or not to implement technology. And so don't necessarily reap the benefits that they could, but in fact incur significant expense and significant time inputs that don't pay off. So I'm a big believer in technology, I really am. But not for just technology's sake. I think it has to be well thought out. You have to have a plan as to what you're going to use this for. And then you have to commit. You have to commit as an organization that you're going to take this technology on and you're going to invest the resources and the time required to, get to a certain, standard or minimum level of usage of that technology so that you can get the benefits.
Awesome. Talking about like cognitive workload, burnout, we talk a lot about the physicians, cognitive load and burnout. As a clinical manager, how much is emotionally demanding this job?
Yeah, you're dealing with people, so it is emotionally demanding. So, you're dealing with staff members, you're dealing with clinicians, you're dealing with vendors, you're dealing with suppliers of all sorts of things. It is definitely, because you're dealing with people, it is definitely emotionally draining at times. Staff being the biggest, because we're all human beings. We don't leave our humanness or humanity or our problems at home when we come into work. Those come with. And so as a manager, dealing with interpersonal conflict, dealing with underperformance because somebody's got something going on in their lives that is impeding their ability to work, dealing with leaves. Leaves are rampant. Most clinics of any size have somebody on leave at any given moment, for some period of time. So dealing with all of that, and these are people, right? These are people that these are people that you care about. It does take a toll on the manager because often as the manager, you're kind of a one of one. So you don't necessarily, because of the position you're in and the confidentiality that you need to hold and the role that you have, you don't necessarily have people that you can lean on or that you can share this with or unburden yourself with or get support from. You kind of have to deal with it on your own.
And what does keep Christopher awake at night? As the clinic manager, Christopher.
The clinic manager. I sleep very well, actually, but I have an ability to detach. As much as I say people don't leave their humanity at home, I'm probably one of the people that leaves most of his humanity at home. I bring my dog to work, but I leave my humanity at home. No, I'm just kidding. But I definitely am able to make a distinction between work, right? Because I focus on results. So if it's all about the result, the other stuff takes less of a place. It's just stuff to get through to get to the result. And I've been in this for 20 years, so I've seen a lot of stuff come and go, and I realize we're all, the people change and things change, but we're all okay. Like life goes on, and the wheel continues to turn, and we still have an ability to improve and to make things happen. So I have that sort of that perspective, but I would say that what maybe keeps me up at night, or would keep most clinic managers up at night, is what is coming that I'm not ready for. And usually that's, which employee or which clinician is going to show up at my door and drop a resignation, or drop a notice of leave, a medical note that they're going to be off for the next 6 months or whatever it might be for their own reasons, that I'm not ready for. And so now that burden comes on to me, right? That I have to find a way to make it all work, because the patient's demand doesn't slow down. The clinician's needs don't slow down. Like everything is, as was.
Keep going.
I just have less to work with, right? So I think most clinic managers, the thing that keeps them up is who is going to drop out on me. And I make that sound personal. It's not personal, but it becomes a little personal for the clinic manager, because at the end of the day, it becomes their thing to deal with.
100%.
Yeah.
And what is that most important topic that you have with your physicians? Like when you are with them when you're negotiating something with them in your own office, what you talk about? What is the thing that is the subject that keeps you, let's say, makes the discussion heated?
So, I always take, I'm well aware that I'm not a clinician. I'm well aware that I'm not doing their work, right? And that I don't carry their burdens. So I always keep that in mind. But I have a job to do. And my job is to see to the financial and operational health of this organization. And a key element to that is physician revenue and physician, I don't want to use the word production, because that takes a lot away from what they do. Their work, right? What they contribute, which is huge, which without them, we don't have a business. We don't have a clinic. We don't have anything going on. So their role is vital. But they are also human beings who have lives, who have other priorities at times, who have stresses, who have limitations, who have, concerns. And so generally speaking, what I'm often talking about is how they can increase their revenue, right? For the good of the organization, but also of themselves, because we share that revenue, right? They actually take the larger share of that revenue usually, hopefully. So I'm often talking about, take on new patients, replace that attrition, bill people for those things that you've been giving away for free. So I make them uncomfortable, because I'm asking them to do things that are not in their comfort zone, that is challenging for them. Because when I say take on, 10 new patients this week or this month, their minds very quickly go to what that means for them. And I get it, right? So it's like, how can we find a way to pace these things out, right? How can we find a way to support them so that they can take on those additional patients? And why do I want them to take on those additional patients? Generally for revenue purposes. Also, at a broader level, we have an access issue in this country, and we all have a part to play in increasing access to primary care for the population. But honestly, mostly it's about the financial health and operational health of the clinic, because we had to keep the lights on and keep the things going.
Awesome. And what are the joyful moments in the clinic, the moment that is celebrated inside the clinic? And let me ask you maybe the question differently. Is there endings that the leader or a clinical manager can bring in the clinic to restore joy and bring this positive vibe?
There's a lot that can be done, and I think and I'm guilty of this, is that we get very focused on the problems the needs or the operations or the endless laundry list of things to do, and we forget to stop and celebrate. And I'm probably the worst, I would say, in doing that. You know, it's not that I don't recognize people, it's not that I don't thank people, it's not that I don't, but that's usually one-on-one, right? But in terms of saying as a clinic, as a group, you know, as an organization, as a team of people, at all levels, you know, having those moments of celebration. We used to do an annual retreat every year. In the summertime. And, you know, it was work, but it was also about just getting out of the clinic, getting out of our daily routines, getting to know each other again as people, doing some fun stuff, learning some things, but really just kind of spending time with each other. Our challenge was always to get the clinicians to come, because for them it's like finally a day. First of all, they maybe would be upset that we closed the clinic, and that meant that they lost a day of being able to see patients. So that puts them further behind, right? And in some ways could impact their revenue. So it's an investment that we ask of those clinicians to come and be part of things that didn't always pan out. But those that came, and many came over the years, those that came, I think, really both gave a lot of value to the experience for everyone, because it was important for the staff to see the physicians there and to spend time with them and to learn from them and to get to know them again as people. But I think they got something as well in terms of, you know, coming away with feeling a little bit more like they were part of something bigger than themselves, and again, getting to know all these people that really keep things running for them and allow them to do the work that they do. So things like that, and they can be any number of things. Sometimes a pizza day goes a long way, honestly, like just bring pizza in for the staff and let them gather in the kitchen and have a slice and a chat for half an hour, you know, while they're in their busy day. That can go a long way. But yeah, celebrating wins, celebrating and thanking and recognizing people, I think, is really important, because it's tough to stay inspired in today's environment.
Do you receive thank you notes from patients or from somebody outside the clinic?
We do. Not nearly as many as I wish we did. We get lots of complaints. Human nature, right? People are quick to say what's wrong and slow to say thank you sometimes. But yeah, we definitely do. We get thank you notes. You know, we also get Google reviews. We get, you know, that's today's thank you note, right? Is a 5-star Google review or a shout out to a particular staff member or to a physician or clinician. I have a cute story where one of the things that so one of our services at Capital Digital is we partner with a group called Clinic Phone, and Clinic Phone are remote medical office assistants, and principally they. Obviously, they work in the background because they're remote, but they answer the phones, they do outbound calling, they deal with patients, they may deal with documentation and things, billing, stuff like that. And they happen to be located in Pakistan, this group. So these agents are not on site, but we don't announce that when they answer the phone. They don't say, you know, I'm in Pakistan. And they do a great job. We treat them as if they are members. You know, we say to all of our clients that take them on, very important that you treat them as if they were a staff member from here. Include them in your meetings, you know, train them in the exact same way. Make sure they have a company email and access to all of the communication tools that you have as a team. But the story is that we had a patient who was so thrilled with their interaction and the help that they received on the phone with one of the Clinic Phone agents, that they put together a little basket of chocolate and treats, and they brought it into the clinic for that specific person. Who of course, you know, we weren't able to ship it to Pakistan, so we all enjoyed the chocolate and said thank you. But it's, you know, it can sometimes be to that level where someone will do that, and those are really bright moments. And we do try to. We used to at the retreats, you know, when we were between presentations or between things, we would have a slideshow where we had those positive comments from patients, and we put them on the screen just to remind people, like, hey. In all of this, there are lots of people that are appreciating what you do, but we don't do enough of it. As a sector, as an industry, and as a society, we don't do enough of it.
Then I cannot stress. There's not enough word to stress how sad it is. I remember during COVID how everybody working in the clinic and physicians and nurses were our heroes.
Yeah.
And a year later, they're the bad guys.
A year later, they get a 1-star review because they didn't answer the phone fast enough.
Yeah, like here in Quebec, we have the government rethink their compensation, and it wasn't a nice process. And how quickly many stakeholders forgot what this industry did for the entire human beings
and the toll
around the globe during COVID.
The toll that it took on people.
100%. So thank you to everybody working in the clinic environment, for physicians to admins to clinical manager. Thank you so much.
On their behalf, I say I appreciate that.
Thank you. Let's switch gears. Technology, AI. What's your take on AI? How this most disruptive of technologies will help the most human of industries?
Yeah, it's interesting, right? I'm a firm believer that there's huge potential in AI. I really do. I think scribes are just the tip of the iceberg, and already they're having a profound impact on those that have adopted them and are using them effectively. This is an evolving technology that is evolving at the speed of light, and so it is normal that we have a few bumps in the road, and that things don't always work as planned, and it raises questions, right, around ethics or around privacy or around any number of things. Patient safety. I mean, I think it's important to use these as tools and not to view these as solutions all by themselves. They are very effective when used effectively by human beings. So when I look at AI, I mean, we have relationships with a number of AI scribe companies where, we thought we'll go out and we'll do some of the homework to say, which of the dozens of scribes that popped up out of nowhere in the last couple of years, which ones, have the best track record in terms of, being very clear about what their security is, what their privacy is, who's been forthcoming, who's got clean contracts, right, where it's very clear what you're embarking upon, who's got great interfaces, who's got, who's using the data that you're putting in there ethically, or I should say not using it for means that weren't intended. And so we create relationships with a few of those, and we have them on our site, and we basically say, we looked at these, we think they're pretty good. We have relationships with them. They're nice enough to offer a discount through us. Go ahead. That's kind of our AI scribe relationship. But what we are looking at more directly for AI in terms of the services that we're offering is how can we leverage AI? And again, I'm a nuts and bolts person. I think there are so many people that are looking at AI from a clinical perspective. What can it do clinically? How can physicians and clinicians use it effectively? That's great. I don't feel I have much to contribute at that level. Where I think I can contribute is looking at AI and saying, how do I use it administratively? How do I use it operationally to improve, what we do at that level in the clinic, which, ultimately has a benefit for the patient experience.
So in this context, what do you think the top use case that AI will come help the administrative part?
So where we're most advanced right now, the two areas where we're most advanced, I think, is basically providing resource to patients to get their functional questions answered. So, for example, we have the ability to put an AI widget on a clinic's website, and then we provide a knowledge base to that AI widget that is essentially all of the documentation, all of the information, all of the FAQs, everything on a website for that clinic. Basically, from when do I get my test results? Where do I park? Who do you offer services in this area? Whatever it might be, whatever kinds of questions that people generally are required to use a phone for now, or to go into the clinic, because you can't send an email to the clinic and expect a response. That's all clinics have an info email, and you'll send something there and you'll get a note right back that says, hey, we don't monitor this. Yeah. Right? So I don't know why we have them, but anyway, we actually do monitor them.
Manage expectations.
We really do monitor them, but don't expect a response. And so basically saying, like, we can probably take a significant percentage of the inquiries that essentially are clogging up the phone lines, clogging up those emails, clogging up the front desk when people come in, and we can provide a resource that is trained on everything we need it to be trained on, always gives the correct answer because it only knows the answer we've given it, right? It doesn't freestyle the way some of our staff do. It is always going to consult the references that we give it, and it's going to be instantaneous, and it can come in multiple forms. So it can be through a chat on the website, it can be voice on the website, it can be through text, or it can be voice on the telephone. So you can call, and an AI receptionist would answer the telephone and can deal with a lot of those direct questions. Now, the one thing that we are not doing at this point, and that's an interesting question for you with the EMR, is it's not integrated into the EMR to answer specific questions about that patient's chart, for example, or to book appointments for that patient. We're not there yet, but I think that's probably coming. But the smile you've got on your face, I think that's coming. Yeah, so that's definitely the next step. But for right now, there's a lot of benefit to be gained just by taking that percentage of calls that are overwhelming an under-resourced front desk, 100%. Right? And essentially getting that information out to people in a way that they want to get it. A lot of people, they just want a quick, easy answer, and we don't make it quick and easy for them right now. So that is probably one of the biggest areas vis-a-vis patient-facing, customer service. The other one is, we have the same issue internally. So we have lots of staff to manage, and we have lots of information that we download to them constantly. We send them emails, we have meetings, we put resources on a shared drive, and we say, go read those things. We maybe run trainings and so on and so forth, and then we expect them to have all of that at their fingertips. Well, of course they don't. Or we say, well, listen, go dig through all of that pile and try to find the answer to your question when you've got the patient standing in front of you or waiting on the phone. It doesn't happen. And so what happens is people quickly ask the person next to them, or they quickly call their supervisor and they ask that question. It's an inefficient way of resourcing your staff. Well, so we can take that same AI bot and we can create an internal page and an internal phone number, and we can teach it everything that we want our employees to know. And we can come to a place where we have the answers to all of their questions at an operational level, and so that they can quickly text or chat or call first that resource versus the manager, versus grabbing the next person next to them and maybe not getting a consistent or a correct answer. So I think AI at this stage, and this is today, like we've got this ready to go today. Where it goes from here, I mean, it's crazy. But I think that we have to be measured in how we bring these tools in, and we can't overwhelm people with everything it can do. I think we have to be very careful about putting little, boxes and packages around the functions, so that it's a very simple process for someone to imagine, what human function is this augmenting, replacing, supporting, whatever it might be, versus saying, hey, I can do everything, right? Because while that might be true, that's too much. It needs to be clear what it can do.
Great. Do you think AI will reduce the number of staff in the clinic?
No, I don't think so. I think it will probably help even out the gaps, because you have to understand the amount of staff in the clinic is already reduced by reality. It's our difficulty in recruiting, it's our difficulty in retaining, it's the people that are on leave, it's all of that, right? So we're already short-staffed. 100%. There's no way that I don't believe that AI is gonna result in, mass layoffs and we don't need people anymore, by any means. I think what AI will allow is that we will better resource the people we have to do a better job, to feel better about the work they do, and to do higher value human-to-human work. I always say, versus somebody answering the same questions over and over again by phone, free them up so that when that person comes in and needs that extra time, needs that extra information, needs that human touch, that they're there for it. They've got the resources for it. They've got the patience for it. They're not burnt out because they've been on the phone for the last 7 hours dealing with garbage. They can actually give of themselves to the patient, I think, or to the clinician they're supporting. Yeah. So no, nobody's going to lose their jobs.
Yeah. Well, I fully agree with you, and I can confirm that AI will do more. Like what Medfire is working on is taking it to the level, to the real integration into the EMR. Whether it's an AI scribe to fill the forms, update the patient summary and help the physician take action, or whether it's on the administrative side, AI, where I think in a couple of weeks, maybe before we release this podcast, we will be booking appointment into the EMR using an MOA AI assistant there.
Yeah.
So it's going there, and in this process, before we deliver any product to the market, we lift the phone and we talk to clinics to really understand what are the most important use cases that we need to solve for, and why they would take it, are they afraid of it or not. And curiously enough, less than 18%, actually 2 over 12, said it would reduce staff. So the majority of clinics doesn't even imagine or consider.
And I think the reality will be 0 out of 12 will actually end up reducing staff.
Yeah, because I think there's 3 contributors to that. The first thing is they're already under-resourced by design and by lack of investment. Second is it's one of the jobs that has the highest turnover in the country. Whether it's on leave or, those students that come and spend 2-3 years in the clinics, and after you graduate, the retirement. So clinics are not able to replace fast enough, so the vacancies. Okay, and third is a lot of things to do in the clinic. And I think we really believe AI will remove the the low value task and free them up to do something more, hopefully restore joy instead of bringing burnout, and really do a real contribution to that.
The reality, Elias, is that we're not doing, there's a lot we're not doing that we know we should be doing or could 100%. Be doing that we just can't get to. And that's across the board. Clinicians will tell you that, administrators will tell you that. So there's no lack of work. There's the work that is already at the doorstep that we're not doing, and then there's the work that we'd love to do if we could only get to it, right? So there is more than enough work. And AI, if it can free people up from things that are lower value or more redundant or more apt to be automated or systematized, perfect, because then we can actually engage humans in something more rewarding and more meaningful.
100%. And we believe that the biggest beneficial of all of this is the patient, because as a citizen, everywhere we go, we have a better service. And what you're saying, Chris, is that clinics would love to do that, but they don't have the capacity to do that. So if AI can come and remove this low-end values and allow them to do the real things, the entire patient experience will change. And I think it's going to be transformative, and we agree on the principle of using AI. And
now, not to throw cold water on the subject, but here's the thing that I think that we have to be very cognizant of, and I think is going to be critical to whether we actually get to that level of adoption and actually see those benefits, is that we have to support those organizations in adopting these tools, right? We can't expect them to do this on their own. They need funding. They need support in terms of human resources, project management, project planning, technological resources. I mean, again, that you and I have spoken before. That's what OPiH and Capital Digital, that's what we see ourselves as doing, is bridging between that under-resourced, overworked clinic, which may not even have had the time to even think about these solutions, or maybe they have, but they're like, that's going to have to be down the road because we don't have the resources. We have this fire and this problem and this priority to do first. And we're saying, well, you can't expect the technology vendor to just arrive and say, go ahead and adopt it and leave it to the clinic to do so. 100%. They absolutely need a lot of support, but that support needs to come with a level of understanding of their reality, right? And technology companies are awesome with their technology, but they don't always have a thorough understanding of the reality of clinics. And by the way, that reality is different for every clinic. So you might have a physician on your advisory board when you do your product development, and what you'll get is a product that works beautifully for that physician and how they work. But then you're going to go down the road to the next clinic and the next physician. They don't work that way. It's very individualistic in how people work in many ways. And so the product needs to be flexible and adaptive enough that it's going to allow them to get the same value without having to suddenly change everything that they do in order to fit the technology. You have to find that middle ground. And so that's the role we see for ourselves is bridging, right? We bring that reality, that understanding, but we also understand the technology, and it has to be give and take on both sides to get to that point where you can adopt that technology in such a way as to not overburden change on the clinic, but at the same time, get the most value out of the technology as it's designed.
So Christopher, when clinics should give you a call? Like when clinics or when they should call Capital Digital or OPiH?
When they're considering at any given point in time. Honestly, I know that sounds a little bit broad, but essentially, the moment they're considering, we have an issue and we need to find a solution, right? They don't know what the solution is yet, but they've got a sense of the problem. That's a good time to call us. That's definitely a good time to call us because, we can do a lot of that legwork to get them to the point of saying, we have a thorough understanding of the problem. We have a thorough understanding of the potential technological or other solutions that exist. And we've got someone to work with that can get us to the point of making a good decision about what we're going to implement, putting the project plan together, putting together all the steps and understanding what we need to change at the clinic level and what we need that technology provider to be able to provide to us in order to get the best benefit and see us through that project so we can implement and hit the ground running.
Awesome. And we talked about how technology can help clinic. We talked about how clinical management expert can help clinic, how government can help clinic, and how is primary care today in Ontario compared to when you started? Is it better or worse? How can you describe that?
So the first thing is when we say primary care, we say primary care like it's a monolith, like it's all the same thing.
Yeah.
It is nowhere near all the same thing. And province to province already big differences. But even within, I'll just speak to Ontario. Within Ontario, the term primary care is like saying Africa, right? There are so many, so many varieties and so many components and so many differences that you can't just think that, that it's one thing. And so when we talk about primary care, are we talking about, 2 doctor clinics that are not affiliated with, any government-funded programs that are living simply off of OPiH and working as, essentially a very siloed, very independent service? Or are we talking about, on the other end, are we talking about an academic family health team, which is embedded within a hospital and a family medicine program? These are completely different experiences, completely different sets of challenges, some overlap, but definitely not the same thing and certainly not the same resources. So, your question is it better or worse? Many things are better, some things are worse.
So you saw different clinical model.
Yeah.
Which one, like between FHOs and FHDs, and which models work best in your opinion?
I think team-based models are definitely preferred, and I think they have a lot of advantages. So when I say team-based models, I'm generally referring to family health teams. That can also be community health centers. They have a very team-based model approach. Anywhere where you've got a collection of providers and allied health providers, which we call them, so physicians as well as a whole variety of clinicians that are working together to serve the needs of the patients. Now, we are far from hitting the limit of what a team-based interprofessional group can do. I heard an expression at a primary care meeting not that long ago, the teams aren't teaming, right? And so what you get is essentially, you get a lot of individual professionals that are working in the same place and maybe refer patients to each other, but it's not team-based care, if you follow me.
Yeah.
It's not what was envisioned even for family health teams, let alone some of the other models out there. So we've got a lot of work to do there, but I still think team-based care is got the best potential, and it's definitely what I think is attracting the newest generation of clinicians. They want to work in teams. They're trained in teams. They're indoctrinated in the sense that they've definitely integrated the benefits of working in a team into their mentality towards how am I going to practice and what's that going to look like and what do I need around me. So I think we've got a population of clinicians that are primed to do well in teams, and so we just need to organize and support those teams in a way that actually takes advantage of all of that potential.
Awesome. So let's end with the big picture perspective. If you woke up tomorrow as a Minister of Health, what the first thing
I'd go back to bed, honestly. I wouldn't want that job for all the tea in China. No way. Yeah.
Any policy shifts?
You know what? I think I said at the beginning that I'm a nuts and bolts, on the ground practical, operational thinker. And so I would never, honestly, I would never pretend that I have anything to contribute at the policy level. I really don't believe I'm educated or informed enough of all of the factors and things that influence policy making at that level. So, and that's not me running away from the question. What I would say is that I think there's a few things that as a society, not even just at the ministerial level, but as a society, we need to come to grips with. Things are changing. If you look at, who's entering family medicine, or I should say who's entering medicine, who's choosing family medicine, and the choice of family medicine used to be, if you look at residency matching, there used to be far more residency positions than there were applicants. And matching was very competitive. In the last few years, a lot of those programs are finding that they're not even making all of their matches, which is very scary. A lot of medical students, when they're choosing their residency and their pathway for what they want to practice in, many are moving away from family medicine and choosing other pathways, and that's very concerning. So I think that that's something that we have to come to grips with. We have to understand too that the notion of and actually one of your previous episodes, Dr. Bourdin, talked about this in BC, that the generation of physicians coming into practice are not our grandfather physicians. They're not the people whose entire life was about being a doctor, who worked, countless hours every week and were always on call for their patients and dedicated their lives until they literally died, in their doctor's office to care for patients. That's not the society we have anymore. It's an important role. It is one that requires huge sacrifice to get into that role, to get through medical school, to get through residency, to become a practicing physician. But I can tell you that the doctors that I deal with, and I'd say we're 2 generations in at least, of graduates who are looking at this not as a calling and a vocation and a life, but they're looking at it as a career and as a job, and they have expectations of how this job will fit with the rest of their lives. And you have a lot more part-time physicians. You have a lot more physicians that want to do a variety of things. And you don't have a lot of physicians that are willing to sacrifice themselves, their health, their mental health, their families, their lives for that role. And I get it. I agree with that. I think that is absolutely legitimate. And we just need to recognize that reality and work with that reality, which I don't think we've done yet. We're asking a lot of physicians. We're asking a lot of them. And I don't think we're giving enough in return as a society.
Can you help me inspire the leaders listening to us? Like, I'm talking here about political leaders. Like, can you give them a tip? Like, how they can recognize it? Because you're 100% right. Like, whether you're a physician or an engineer, you deserve this. You deserve a great work environment.
Yeah.
You deserve great work conditions. You deserve to be well compensated. You don't deserve to be burned out.
Yeah.
What leaders, governments can do?
So I think I'm going to get to the answer, but I want to say this. I've interviewed or met with, in 20 years, right, hundreds of people that are entering healthcare at every level. I deal with new graduate physicians, I deal with medical students, I deal with residents, I deal with people that want to be nurses, people that want to be any number of allied health professions. I've interviewed for all those roles in my career. And at some point in every one of those interviews, what comes to the surface is that the motivation of that individual ultimately is to help people. Everybody says that they want to get into this, and they've come to my door to apply for this job, whether it's a receptionist or a family physician, because they want to help people, because they want to have an impact, because they want to improve people's lives, right? The reality, once you get into it, and I don't want to discourage anybody. That's the last thing I want to do, because there's enough of that already. But once you get into it, it's easy to feel like the system is set up in such a way that the helping people and the having an impact is very difficult. And you start to lose sight of of that. You start to feel like that is a further and further away possibility.
You forgot the purpose.
You don't forget, but I think you almost not give up. They haven't given up. People have not given up, but I think you start to really feel discouraged that, it isn't about helping people as much anymore. It's literally about just throughput, just keeping our head above water, right? And so what I mean by that is I think, and I don't have a lot of good solutions, but I think governments and as a society as a whole, we need to find a way to support the people that work in healthcare to have that inspiration back, to get that inspiration back, that thing that brought them to healthcare. Like we can't be dulling that shine. We can't be taking away from that and killing that in them. We need that to grow in them. They need to see a path to how does what I do help people? How does what I do have a positive impact on people's lives and on the society as a whole? One of the ways is removing the bureaucracy, removing the work for work's sake, removing, all of those things that we see as, and providing resources, removing those things that are barriers to the end goal, the result. I'm results focused, right? Yeah. How do we help people?
What they're doing right that they absolutely need to keep doing.
They meaning government? Or
government.
Well, I can speak to Ontario again, because I know there's been some challenges recently in Quebec with new legislation being introduced that affects physicians. But in Ontario, there's a massive investment in primary care right now. There's a massive investment. It's a double-edged sword. I'll tell you why. It's great to have new money. It's great to have the ability to propose things to the government and have actually a chance at being funded. But it is a layer of the primary care system that really has the ability to even get into the ring and put together a proposal, because the burden of preparing an application and of meeting all of the criteria and of going through the process, right, without any clear idea if it's going to be accepted or not accepted, because you're not given a lot of parameters as to what they're looking for, right? And then when will it be accepted? And then how do we plan for it? And then what resources come to us that allow us to actually implement those things? There's last count, I think it was 2.4 billion over the next however many years. A lot of that is earmarked for new projects, new groups, new family health teams, new everything. It's great, but to get there, to apply for that money, it's a select few that actually have the resources to do the process. So that's part of the issue. I think you need to make it more accessible to a lot of those groups that just aren't there. So that if they could remove a lot of those barriers and hurdles. But then the other part of that sword, or double-edged sword, is that you get the money, and great, you can go hire 3 new NPs, 2 physician assistants, and 5 nurses. Well, where are they, right? You're going to end up poaching them from other parts of the system because we're not graduating and attracting enough of those individuals. We're not licensing enough of those individuals from other provinces or from other jurisdictions, other countries. We've not made that very easy. And so essentially, it's great to have that new funding, but if I know lots of groups that were funded in the first round who still haven't made any hires.
Yeah. So basically what you're saying, we need more qualified people.
Yeah.
The money's there. That's a great news.
Yeah.
Keep doing. Yeah. Find a way to graduate more faster or bring more people faster to be able to support the infrastructure.
Otherwise we get discouraged, right? That's what I'm saying, is we get discouraged. So I know that sounded very negative when I went on a bit of a rant there, because I think you were saying, what are they doing right? But they are making investments. They are making investments. I think they're listening. It's such a big, complex system that we have to understand. It's going to take a lot of time for these things to change, and they need to be sustained through successive governments. We can't always new government, whole new approach, drop everything you were doing, now we're doing this. We got to get away from that. But I think in Ontario there's been good investment at that level, and I think decent support. They can do more of that for sure, but let's make it easier, and let's make it more equitable in terms of the groups within the primary care world that can access that funding easily.
Yeah, I'm very happy to see Ontario and even British Columbia did a lot of reforms. True. And they're ending up to be successful, a bit like on the right track. I really hope other provinces do the same thing. I think because this sector is very important for us, for our children, for new generations, and something Ontario did very well, made sure money is not going to be the issue. So let's keep working in this area. Before we conclude, what is the most important message you want to leave physicians and clinicians and clinical managers listening to our conversation?
Well, I think that for me, the most valuable thing that I've had available to me in my career is the ability to connect with others. The ability to sort of get out of my silo, get out of my office, figuratively, but also actually literally, go out and see other people, see other operations, clinics, whatever it may be, connect with them. I think it can get very lonely and siloed in the current climate and the way things are set up, because we're so focused. I mean, physicians and everybody else, right? What do we spend the most of our time doing is interacting with a computer, with a computer screen in our office. And so, where I've gotten a lot of value is through, industry associations. A shout out to one that's very near and dear to my heart is the Ontario Medical Group Managers Association, the OMGMA. This is a place where people in clinic manager roles, which is usually a one-of-one in that organization, so they don't have colleagues per se within their own organization. They have an opportunity to have colleagues that are, in similar situations around the province that have the same struggles, have the same issues, and we can exchange on that, and we can help each other. We can share resources, we can provide support, we can do any number of things together. And I think, as a concept or as an activity, it's very important, and it's probably kept me going, and I think it's kept a lot of people going. And I see a lot of clinicians, because of the level of busyness that they have both in their practices and in their lives, are not showing up at some of the tables, right? They maybe go for continuing medical education because that's required of them, and they'll get some of that, right? But they're, in terms of the side of operating the clinic, or what are the opportunities that are out there, like many physicians are not even aware of the funding opportunities or of the supports that are out there, because you had to have been at the meeting, you had to have shown up at the at the government-led thing where they talked about that, and they're head down doing their work. They don't see that, and I think it can be very lonely. And you can get a lot of support and inspiration from spending time with your colleagues in one way or another. So I would say that that's an important piece that people shouldn't forget. Christopher,
thank you so much. It was very insightful. You've been very generous with us during the show. I'm pretty sure the listeners enjoyed it. Thank you so much. It was very inspiring.
It's been my pleasure. And can I do a self-serving plug for myself?
For sure.
One more time. I probably did a few. So one of the things that you've inspired me to think about with this podcast is to create a YouTube channel. So I've created a YouTube channel. It's called The Clinic Manager. So it's not a very creative title, but I'm a nuts and bolts kind of guy. I'm to the point. And so the Clinic Manager is intended to be a place where, I can talk about different things that are relevant to clinic managers. So it's not, I have no designs on becoming famous or getting rich from likes and views and going viral or any of those things. My goal is for people like me to have another resource that they can go and hear about different ideas and things that are going on. My intention is to have guests and to have others that are involved in healthcare come on and talk about what they're doing, but it's always going to be from a practical nuts and bolts. What can I take from this and use it tomorrow in my clinic? That's the idea. So, I'd love for people to check it out.
Well, congratulations, and thank you for doing this, because we need more of those. Actually, I don't recall it exists. So,
well, I did a search and I couldn't find one, and so I said, if I want there to be one, I guess I'm going to have to make it. It's not because, honestly, I've been thinking about this for a long time, but I have to get over my fear of being public, the vulnerability that comes with putting yourself out there, and honestly, that's been my biggest hesitation. But I'm just going to go for it.
Awesome. Congratulations. Thank you so much. I wish you all the success.
Thank you.
Once again, thank you for being with us.
Yeah, it's been my pleasure. This is great. Thank you so much.
Thank you.